Our next speaker is Kristine Phillips. She's Associate Professor at the University of Michigan in Ann Arbor. She received her Ph.D. at LSU. She was an M.D. then at Hopkins, intern and resident at Hopkins, a fellow in rheumatology at Brigham and Women's Hospital, and then a clinical fellow at Harvard Medical School, and she's going to talk about central pain mechanisms in the rheumatic diseases.
I'd like to thank the organizers for inviting me to talk today. My voice is a little hoarse. If you can't hear me, please let me know. I'll try to speak up. I was asked to talk about central pain mechanisms in rheumatology diseases. This is a topic that I'm frequently asked to talk about because of the work that I've done, some of the work that I've done with Dan Claw, who some of you may know. He's an expert in fibromyalgia and chronic fatigue and runs the Chronic Pain and Fatigue Research Center at the University of Michigan. I don't have any disclosures that pertain to this talk. This is an overview of what I'm going to be talking about today. I'm going to describe a little bit about the background on central pain mechanisms, some of the terminology, some of the tests that we can do, and where we are right now as far as our knowledge about central pain. And then I'm going to talk about how that pertains to rheumatologic disease, the implications for practicing rheumatologists. And I'm also going to touch on some practical management strategies at the end in the last third of the talk. Most of my work is patient-focused, and since this is a clinical conference, I thought it would be appropriate to start off with a few clinical cases. So this is a clinical vignette. It's just a little window because I'm going to introduce some ideas now and discuss them further in the talk, and then we'll wrap up at the end. So this is a 60-year-old woman with hypertension and irritable bowel disease who presents with widespread diffuse joint pain. I saw her a few years ago to rule out rheumatoid arthritis, and she didn't have rheumatoid arthritis. But when she described her symptoms, she explained that she'd been sleeping well, but she felt very fatigued. Fatigue was her #1 complaint. She didn't seem to meet criteria for depression. She did not seem to be clinically depressed. And she had occasional mild anxiety when she was on a plane ride or in an enclosed space, but did not really have anything out of the ordinary for her. The second clinical vignette is a 50-year-old woman who had chronic pain in sort of a widespread distribution over her shoulders, elbows, hip girdles, legs, and she also suffered from profound fatigue. She had a number of comorbidities, diabetes, hypertension, hyperlipidemia. She also suffered from insomnia and steatohepatitis. She was evaluated for the widespread diffuse pain by checking CK levels. A thyroid test was ordered. She had hepatitis serology sent, and all of those came back negative. Because she was on a statin for her hyperlipidemia, it was held thinking that this may be contributing to her symptoms, but despite holding it for 6 months, there was no improvement. And the third clinical vignette is a 45-year-old woman with a history of seropositive rheumatoid arthritis, treated successfully with etanercept. When she came in complaining of pain, she did not have any synovitis of her joints. Her sed rate and C-reactive protein at that visit were normal, and in fact, prior to this, they had been normal as well. And she reported that for the past 4 months, she endorsed more stress in her life. She'd had a decreased mood, some fatigue, and diffuse widespread tenderness of all of her muscles. So which diagnoses should be considered in these patients? And what are the pain mechanisms that might be involved in each individual? And then what are some potential management strategies? Just to outline for you the importance of chronic pain in our society, it affects a large proportion of our population. Well over 100 million people suffer from some form of chronic pain. And this is more than if you combine all of the patients who have cancer, cardiovascular disease, and diabetes. It's an